Welcome back to our video series on pediatric respiratory conditions. In this video, we're going to talk a little bit about asthma. Asthma is a chronic and inflammatory condition that affects your airways and is recurrent. It causes airway obstruction, bronchial hyperresponsiveness, and we also have to deal with mucus as well. It's the most common chronic disease in childhood and one of the biggest reasons that kids miss school and miss out on activities. We classify pediatric patients into 4 different categories of asthma. Depending on how many days per week you have symptoms and how severe those symptoms are, you will be placed into one of these 4 categories. It starts with mild intermittent asthma, and it progresses to mild persistent, moderate persistent, and severe persistent. There are many potential triggers for asthma, some environmental triggers, allergens, and viral illnesses. Usually about 70% of asthma exacerbations are triggered by viral illnesses and 30% are triggered by allergens or environmental causes. This illustration is an excellent example of the pathophysiology of asthma. As you can see, there is an IgE pathway built in here, which explains why allergies is involved in asthma, and also why children with asthma may have atopic dermatitis as well. The end result of this pathophysiologic process is mucosal edema, bronchospasm, and mucus plugging. And it's very important to remember these 3 things because we're going to want to treat all of these later. Remember that inflammation plays a significant role in asthma pathophysiology. For this reason, we tend to use medications such as steroids as a key component of asthma therapy. Bronchospasm and obstruction are the 2 other processes that we need to address when we're treating asthma. The inflammatory response, airway edema, and accumulation of mucus, all things that you were able to see in the prior illustration, are things that we need to treat in order to get this patient feeling better. An asthma exacerbation is basically just a flare of these symptoms. Signs and symptoms that are associated with asthma exacerbations include shortness of breath, cough, wheezing, chest tightness, or any combination of these. In fact, if the exacerbation is severe enough, the patient may not be moving enough air to create wheezing. So just because a patient isn't wheezing doesn't mean they're not having an asthma exacerbation. The classic manifestations of asthma are shortness of breath, wheezing, and coughing, like we said earlier. And remember, you're going to want to know a little bit more about each of these. When do they happen? What do they sound like? How often is this occurring? Etc. The cough in asthma is usually described as hacking and irritative. It's basically just an incessant cough that they can't get to stop, and that becomes worse whenever they need to exert themselves, such as with activity. Here's a more comprehensive list of the clinical manifestations associated with asthma. Due to the mucus plugging and air trapping, the prolonged expiratory phase is one of the key components. Keep in mind that expiration is a passive process, so all of those narrowed airways are really struggling to get the air out, whereas you have muscles to help you get the air in. And also keep in mind that it doesn't feel good when you can't breathe. So these children are going to be restless and apprehensive, and they're just not going to feel well. For our children who are having asthma exacerbations or are prone to have asthma exacerbations because of any IgE pathway, such as seasonal allergies, they may be on a daily anti-allergy medicine, such as the Zyrtec shown here. Rescue medications are the hallmark of asthma treatment. Beta-adrenergic agonists, such as albuterol or levoalbuterol, can be administered with either a metered-dose inhaler or nebulizer. Corticosteroids are also important because of the inflammation that we talked about in the last video. While these are not rescue medications, we use these in combination with albuterol or levoalbuterol to help control asthma exacerbations. A great example of oral steroids is prednisolone. A great example of inhaled or nebulized steroids would be Flovent or budesonide. Additional asthma medications can include, but are certainly not limited to, leukotriene inhibitors, like Singulair, which help with allergies, anticholinergics like ipratropium, which is also called Atrovent. Where you typically see this medication is in the ER or in the hospital. Patients rarely need this medication at home. We also have a plethora of other things that can help us either reduce inflammation or open up the airways. Just like it does in labor and delivery, magnesium sulfate can really help reduce smooth muscle tone and open these airways for our children. Please continue on to the next video, where we'll talk about cystic fibrosis.